Hi there, my name is Abby Crill, and the country that I've chosen for this project is Liberia. Liberia is located on the west coast of Africa. It has approximately 4.8 million people as of 2018. As of 2019, it was ranked number 9 out of 10 of the poorest, least developed countries in the world. On this list, actually, every country was located in Africa. So, the top 5 leading causes of mortality, of course, right at the top is malaria. Malaria is the leading cause of death, especially among pregnant women and young children. Malaria typically is transmitted through mosquito bites. It eventually leads to high fever, severe dehydration, through sweating, vomiting, diarrhea, etc. And over here you can see that has stayed pretty consistent at number 1 from 2007 to 2017. Number 2, diarrheal diseases, which used to be at number 4 and has worked its way up to number 2 as of 2017. So that is getting worse over time. Number 3, neonatal disorders. In 2018, neonatal mortality rate was around 25 deaths per 1,000 births. This has improved over time, actually coming from an average of 94 deaths per 1,000 births in 1969. And neonatal disorders has also stayed pretty consistent at number 3. Number 4, lower respiratory infections like pneumonia, bronchitis, tuberculosis. Some of the contributing factors to these are exposure to polluted air from unclean sources of cooking fuel like coal and biomass. It was also found that the incidence of lower respiratory infections was higher in children that lived in homes with unimproved toilet facilities, which I thought was interesting. And that has actually gotten worse over time as well. That was at number 5, is now at number 4. And then number 5 is ischemic heart disease, which also is getting worse. Was it number 6? Is it number 5? Was it number 5, at least in 2017? The life expectancy is about 57 years for males and 60 years for females, which is among the lowest in the world. And you can see here on Gapminder, I'm just doing the year from years 2010 to 2019. But you can see here that it goes up, continues to go up, and then there is a drop in the life expectancy around 2014, likely due to the 2014-2015 outbreak of Ebola. So then, of course, that starts to improve. Life expectancy starts to go up at about 65. In 2010 it was 61, 2014 59. So a significant increase, I would say. And let's go back. Okay. Cultural practices contributing to lower the non-communicable disease prevalence. Liberians' diets consist of rice, some meat, fish, fruits such as mangoes, bananas, coconuts, plantains, and citrus fruit. Consuming large amounts of refined sugars, of course, can lead to obesity. Local vegetables such as eggplant, peppers, pumpkins, and greens are generally sold at markets, but there's a very small population of people that are actually able to afford these items. The prevalence of obesity in Liberia is low. However, malnutrition is an issue, so while their diets have less sugar, it's clear their diets aren't as high in healthy fats and calories. With rice being a staple, men and women and children spend a lot of their time tending to the growing of rice, with women and children doing the majority of the planting, weeding, and harvesting, which obviously working in agriculture requires people to be outside and be active. So these labor-intensive jobs is helping them to get exercise, essentially. Owning a car in Liberia is a luxury, so most people get by on foot or public transportation. Getting by on foot, of course, allows Liberians to get exercise and get their heart rate up by traveling several miles or up and down hills. Malaria prevention. Liberians do take caution with the spread of malaria. Practices such as using mosquito nets, applying insect repellent, wearing long sleeves or pants, etc. are all things that are generally used by Liberians. They are aware that these are things that will help them with the spread of malaria. With the primary, secondary, and tertiary prevention, first and foremost, of course, for my primary preventions is education. Educating Liberians on the top leading causes of death in their community and not limiting it to just the top 5, obviously. Then educating Liberians on how to prevent these leading causes of death, such as encouraging healthy diets and exercise, and informing them of the things that they're already doing in their daily lives to help with the prevention of these things, like their low intake of sugar or their being active with working in the fields. Informing them of the risks and symptoms of malaria and what to look for, and of course how to prevent these with the nets and repellent if they don't already know, if they're not already aware of these things. Although it does sound like a lot of the population does know, so that's good. For secondary prevention, it's no secret that the healthcare system is in low-income countries such as Liberia needs work, so working towards better access to healthcare, perhaps building small clinics throughout the towns that are closer to people so they don't have to travel nearly as far. For tertiary prevention, in tertiary prevention, this is where a person is already dealing with a particular condition. So we want to educate, again, kind of like back in primary, and education is good in each set of preventions, obviously, but we want to educate the people on what to do now to either get rid of the condition through medical care or regular at-home routine care, precautions, people and places to avoid, etc. We are learning a lot about that right now with what we're dealing with here with the coronavirus. So anyway, here are my references, and thank you so much for listening.